you would have asked me almost 2 years ago what I would be doing today, it was definitely not sitting at a table having this discussion about addiction and mental illness.
Mm-hmm.
So that's a little bit of my experience.
Thank you.
Yeah.
Thank you for sharing.
And we're thinking about emergency mental health response services. And so, thinking back over the years before you've become in this recent part of the recovery journey, can you think about parts of your life where having an emergency mental health response service would have been an important thing, could have made a difference?
Absolutely. Before I found recovery, I had hit rock bottom and was left for dead from an overdose. I was brought to the hospital, and I was just after the overdose, I was released into police custody, and then just kind of passed around. I was detained for a few hours, and then just let back out on the street, just to be rearrested, detained, let back out on the street, rearrested again, and then just put back out on the street, where eventually I'd gone to the hospital seeking help, the same hospital I went to for my overdose, asking for help, and I was just told that this is not a shelter. Right? There's nothing they could do for me. I was issued, because it was close to Christmas, I believe. She said I was told it was some sort of incentive that they were doing because it was Christmas time. I was given a $50 gift card and said, asked if I was going to use it to buy drugs, and then sent on my way. So to have an emergency response team where there's measures set up for people suffering from addiction, right, or mental health, that it's handled appropriately, because the last I heard, being an addict or having mental health is not it's not against the law, right? It's not criminal to be an addict or to have mental illness, and it shouldn't be treated as such.
Right.
Yes.
So that would have definitely helped.
Yes. Well, that's the key point that we want to be able to emphasize and to get to. And it's because of this key point that I want to register on behalf of our party today this commitment that an NDP government will implement and establish an emergency mental health response service across the province, so that we will have mental health professionals responding to mental health emergencies.